Hi, I'm Richard Young. I co-direct the aesthetic program at Loma Linda University. I'm in private practice. So like all of you, I'm in the trenches every day, and I'm going to give you a couple hot tips that apply to BioClear and the matrix system, as well as a basic principle in any composite work. First off, I want to say that media dent and sealing, which is basically placing your bond first and curing that and putting a very thin layer of flowable and curing that, is one of the best ways to reduce stress and post-op sensitivity if you're not going to go to injection molding and the BioClear concept. So just a hot tip for those of you who maybe aren't going to convert over right away. And that can be applied for class 5s, any restoration you do. But moving into the BioClear world, a couple principles. Again, the first hot tip is we talk about bioblasting or using aluminum trihydroxide to clean biofilm off of teeth. If you use that even for your day-to-day bonding, your enamel bonds are going to be so much better because biofilm is not removed by etch. And a lot of us used to think it was, but it's not. So with the aluminum trihydroxide blasting, we have a wonderful surface and a matrix to bond to. And so we prepare that beautifully. So whether you're doing BioClear or any kind of composite, think about that. The next thing is when you move to the matrix in the posterior, one of the problems that we see is people don't understand. They'll buy the kit and maybe not have actually taken a course. I'm going to give you a couple really quick tips. Rubber dam actually makes it easier, believe it or not. Pre-wedging is so important, and when you pick your wedge, look at your x-rays and look at the interproximal space, and that's how you select the width of the wedge that you use because they're all the same height. You then place your wedge as though you're using a suture needle to slide that wedge in. The other principle that we see people having a hard time is seating the actual matrix. So by pre-wedging, you actually pinch the papilla rather than crush it, and you create a space for that matrix to slide down. And by creating that space, it becomes much easier to slide that matrix in. And so the wedge is designed to do that. And the third tip is when you're placing the matrix, there's a little tab on it. That tab's not to carry the matrix over with a cotton pliers. It certainly can be used for that, but when you slide that matrix in, take your thumb and depress that tab over onto the adjacent marginal ridge of your proximal tooth, and then push down on that tab, holding it down while you slide your wedge back in the procedural steps that you might have looked at online and the order that we do all of this. Because the matrix likes to climb out on its own, especially with rubber dam. And so with that tab, it does two things. It lines up the marginal ridge height of the matrix, and then it also keeps that matrix down while you slide the wedge back in. And then always remember, the matrices are mylar. You're free to trim them. If they're a little too long and your marginal ridge is too high, you can trim a little bit off the base of that matrix and then slide it down in. So hopefully those tips will help you clear up a couple things and give you some tips that you can actually take home Monday morning. Thanks.